Thank you, Alex. I would like to thank COLDA for giving me the opportunity to present this short abstract that it's called Reducing Read Time of Point Care Tests Does Not Affect Detection of Hepatitis B and Correlates with HBs antigen levels. As you know, global elimination of hepatitis B will require increases in screening and diagnosis. A point-of-care test for HBs antigen can be useful for testing large and difficult-to-reach populations, particularly in community and in resource-limited settings. HBV DNA, the quantification, it's still or remains the gold standard for detecting active infection. It requires serum and plasma samples and specialized lab infrastructure, restricted its application as a point-of-care testing. There is a prior experience using OraQuick, a rapid test with OraQuick for hepatitis C, and a rapid reading is correlated with the presence of hepatitis C viremia. And with this in mind, we aim to evaluate whether a point-of-care testing for HBs antigen can identify individuals with high HBs antigen levels throughout a shortened reading time. So probably with the potential idea if we can reduce the need of HBV DNA testing in settings where molecular diagnostics are limited or not available. This is a prospective study. We started in January this year, and I am going to present the results of the first 5 months. The study is still ongoing. We recruit 133 well-characterized individuals with hepatitis B, HBs antigen positive, the majority 117, few with past infection, 4 cases, and 12 healthy controls. These are patients that attended my outpatient consultation, and in all of these patients, we did serum quantitative HBs antigen and HBV DNA in serum using commercial tests, and also at the same time, we did a capillary blood HBs antigen rapid point-of-care test using the Abbott test, which the recommended at the label reading time is between 15 and 20 minutes. In all cases, time to positivity, time of detection of the first line was recorded. These are the results. All HBs antigen positive by the standard test were also positive by point-of-care testing. All past infections for cases were negative by point-of-care testing, as well as all the healthy controls. Then we analyzed the point of care time to positivity reading according to different phases of infection, particularly because the majority of our patients are or inactive carriers or patients with chronic hepatitis B, E-negative both, very, very few E-antigen positive. I am going to concentrate in E-negative patients. So those with HBs antigen negative infection and with levels of HBs antigen below 1,000, that is usually the criteria that define inactive carriers, the time of reading was large than those with high levels of HBs antigen. Those with high levels of HBs antigen, the time to positivity was 1 minute versus 3. And among those patients with chronic hepatitis B, we also see the same difference. Those with higher levels of HBs antigen, higher than 1,000, have a shorter reader time. And we observe a strong correlation between HBs antigen levels versus the point-of-care reading time. We try to do in a similar way with quantitative HBV DNA and the detection of HBs antigen by point-of-care, with the idea if this can substitute or be useful for detecting patients that could be candidates or potential candidates to hepatitis B treatment. So here it's more difficult because we have among the E antigen negative patients with chronic hepatitis B, we have a high proportion of patients under treatment. But again, we found here that patients with high levels of HBV DNA have a shorter reader time of point-of-care testing. The correlation here it's weaker, still significant but weaker, and we can identify that a minute reading point has a positive predictive value of 88% and a negative predictive value of 100% for identification of HBs antigen carriers. That means HBs antigen levels below 1,000 and HBV DNA below 2,000. So in summary, point-of-care HBs antigen testing provides a rapid and reliable method for HBV screening in community and resources-limited settings. Shorter reader time of point-of-care correlate with a higher HBs antigen concentrations, enable identification of infected individuals across all stages of infection. There is a strong correlation between HBs antigen levels and the point-of-care test performance, highlighting the potential of use this as a surrogate marker for active infection. But these preliminary results need to be validated in other populations, in other genotypes, and I think we need to increase the sample to better understand this. So thank you very much.